You provided the bridge to the medical conversation, so I'm going to take it.
Okay, go for it.
Yeah. So I saw a post recently by a doctor, I think I shared this with you, that is super frustrated by a problem that we actually solved at Acuitas Health, which was the prep. So the prep that a primary care doctor does the day before. And good doctors will look at their schedule the day before. They'll go through and they'll pull in all the information they need, which is really hard to do in an EMR because it's spread all over the place. And so, say they have 10 patients, they're going to spend an hour or two or maybe more trying to get the latest on each one so that when they go into the visit, they're prepared. And so at Acuitas, we use technology, we use AI, we use a lot of things to coalesce this information into one place, right? From different locations, from the EMR, everywhere. And I saw this doctor post this problem again. And this we solved this problem 4 years ago and it's still out there, right? Um, and it seems this, in addition to other things, are a big opportunity for LLMs and for technology, maybe. Because right now, the biggest use case for this in primary care is an AI scribe. But I think we're seeing that plateau a little bit. And it's so interesting because human scribes, virtual human scribes, and even in-person human scribes were a thing before
Right.
LLM chatbots appeared and AI scribes appeared. And I think everyone had the expectation that it would be a one-for-one swap. And it is not for all the reasons we talked about. But I think there seem to be a bunch of opportunities in healthcare. What do you think?
Yeah, no, I think 100% to your comment around the solopreneur versus a big company. What I think carefully crafted Gen AI applications, agentic application, pick the word you want to use, can do is it can solve for that scale problem, right? So if you're a doctor, and I read the post, right, what the doctor's talking about is I have to sit there, I have to do research, I pull all of these things, I synthesize the information, I summarize it. That's an LLM does that really well. Now it does it really well, assuming you give it the right lens of how to evaluate the information. This is where the domain expertise comes, right? If I today say, hey, summarize all these medical records and tell me what I should care about, again, I'm not a doctor, right? So I don't know what good looks like in the outcome, but there's a huge opportunity because these things can parse through a lot of information, dissect it. One of the things that LLM did, to your point, when you were talking about Acute, as we did this 4 years ago, is like AI existed a long time ago,
Yeah.
but it was hidden from the people because it wasn't in English or in your language of choice. It wasn't written. Now it's written, right? Like now you can access all this information writing how you talk. And that, I think that's what catapults all of this information. It does it really quickly. So there's a huge opportunity, to your point, is take all the things that a practice does, again, model the workflow,
Mm.
understand each step, and I think there starts to be a ton of value on not just like, because what you also don't want is a proliferation of tools. I have this one tool that does this one thing really well. Then I have this other one that does this one thing really well.
Yeah.
I think where you get to the next step, put all of them together and find things that you would miss otherwise. Doctors don't necessarily miss something because they don't know what they're doing. They do it because they're overworked. They don't have the ability to actually put all the pieces together to think through and think it and say, you know what, I just saw Keegan 2 weeks ago. Keegan said this, and now he's saying this, and now there's a gap. You could do that now if you have technology that actually helps you point those things out. And it's a matter of just access to the information in a quick way that extracts what you need.
Yeah. So to your point of breaking down the tasks, I think this is currently one of the biggest failures of or AI in general in healthcare is that its initial use case is very targeted at billing. And we already know that billing is flawed. And so it's been this virtuous cycle of we need this to bill. And so it has to be good at billing. But right. And so it's like just reinforcing an existing problem. And the way it's creating notes and the way it's digesting information is all with that goal in mind, not with health and improvement and noticing the nuances like you just described in mind. And those are like the commonly used tools. But when we actually break down the workflow and read posts like we did, you start to tease out what the actual problems is. That's not a coding problem. That's a workload. That's a workload and UI design. And I could go on for probably an hour about all the reasons that problem exists, but it has nothing to do with billing and everything to do with providing good care and building relationships. And I think that's been the failure so far of a lot of applications in healthcare that I've seen.
Yeah, I think healthcare is uniquely interesting because the sad reality is the incentives are different, right?
Yeah.
You're selling software to practitioners really at the benefit of the payer, right? It's misaligned incentives. You're optimizing for a very different thing, which makes it really hard. Other industries don't necessarily have the difficulty where the users are not the people that actually hold the money, right? Like in my case, the people buying the products I'm building are the people using the product that are getting value from it. I think healthcare is challenging, but also has huge potential because there is a gap right now between the people that pay versus the people that use it. But I do think AI and well thought out products have the potential to actually bridge the gap. I don't necessarily know if you break it, but you at least can bridge it enough to not have the experience suck for the people actually delivering care and
Makes
the people getting the care, which is the other piece here.
Yeah, so many things we could talk about just in terms of bridging the information gap between doctor and patient.
Maybe that's video blog too.
Yeah, I think anything you want to say and to wrap this up, this has been a good conversation. Hopefully I asked the right questions.
No, this was good. I think it validates a lot of what I'm seeing, and it was super interesting. It was super interesting so far. So I think it was, yeah,
So
rounding me off.
closing question, like what percentage of actual AI LLM adoption actually do you think it actually exists in the market versus the things that versus the perception? Do you think like 50% of the companies out there are like actually
think
adopting?
it depends on the I think it depends on the role within the industry. So I can tell you from what I've seen, and this is I know it's called an anecdata, right? Like
I like that.
it's not data, it's anecdata that I've captured. I think if you talk to people in tech, very high. Even if it's like simple experimentation,
Yeah.
help me do some research, help me clean up this document, to now literally starting to say, here's what I want to build, puts together a plan, and you have very capable engineers execute and let AI get there. So I see that, and that's what I do for myself. And then I go out into the field to talk to our customers
Yeah.
in in again non-tech roles, even at large companies, but their job function is not a tech function, and it's the complete opposite, right? It's more like we're still afraid of it reading our personal
Yeah. So
information, so I'm not even summarizing an email with it.
5% or less.
Yeah, I think it's, again, I don't have a number to put to it, but I've been very surprised
Yeah.
by the low adoption in non-tech oriented roles. That was very astonishing. I think it was one of the things that prompted us to want to have this conversation, was a comment I made
Yeah.
around just
And we
just
live.
that. I think it's getting better, and I think some of the enterprise products that get rolled out that people start to play with will start to give people that comfort that, like, okay, look, I know, because in the end you have to try it to know what works and what doesn't work. If you don't try it, you don't know where the rough edges are, and you don't know what's good at it and what isn't.
Yeah.
It's the best way to actually just learn.
Yep. No, that actually tracks. I think actual adoption is much lower than we think it is. We live in a silo too. But
Correct.
yeah,
Yeah, I've definitely seen that 100%.
cool. Thanks for taking the time. We'll do this
Of
again.
course. Yeah, of course. This was good. I appreciate it.